Good morning, everyone. My name is Kathryn from Pharmacy Cohort 2025, and today I will be presenting my review paper entitled Evaluation of Long-Term Impact of Repeated Botulinum Toxin Type A Injection. Botulinum toxin type A, more commonly known as Botox, is one of the most widely used cosmetic treatments in the world. While it is generally considered safe, many people wonder whether repeated injections over a long period of time can cause negative effects. Therefore, this review aims to evaluate the long-term safety and efficacy of Botox treatments. First, let's discuss some background information. Botulinum toxin type A, or BONTA, is derived from the bacterium Clostridium botulinum. Although the toxin itself can be dangerous in large amounts, controlled doses are widely used in cosmetic and medical applications. In cosmetic treatments, Botox works by blocking the release of acetylcholine, a neurotransmitter responsible for muscle contraction. As a result, the targeted muscles become temporarily relaxed, reducing the appearance of wrinkles and facial lines. The treatment is popular because it is minimally invasive, produces visible and instant results, and requires very little recovery time. However, the effects only last around 3 to 4 months, meaning that patients often undergo repeated treatments to maintain the desired appearance. This leads to an important concern. Because Botox effects are temporary, many patients receive injections multiple times over several years. As a result, question arises regarding the long-term safety of repeated injections. Some concerns include possible muscle atrophy, facial asymmetry, altered facial expressions, and potential immune or systemic effects. Although many studies discuss the short-term effectiveness of Botox, fewer studies actually focused on the long-term consequences of repeated use. Therefore, further evaluation of the available literature is necessary. Moving on to the objective. The objective of this review was to analyze the effects of long-term and repeated injections. Specifically, this review focuses on 4 main aspects. First, the safety of Botox treatment. Second, its efficacy in wrinkle reduction. Third, its advantages as a cosmetic procedure. And lastly, fourth, its disadvantages and possible long-term side effects. To conduct this review, a systematic literature search was performed using databases such as PubMed, Google Scholar, ScienceDirect, and Wiley Library. Keywords such as Botox, long-term effects, injections, and clinical treatments were used during the search process. Only peer-reviewed articles published in English language between 2018 and 2024 were included. Unreliable sources and irrelevant studies were excluded. Initially, there were 18 articles that met the screening criteria, and after further evaluation, 6 highly relevant studies were selected for further detailed analysis. These studies consisted of randomized clinical trials, narrative reviews, case studies, and analysis papers. Here I provided a table of the literature summary. The selected studies provided valuable insights regarding Botox treatments. First, Kathryn and colleagues reported that more than 80% of subjects experienced significant aesthetics improvement following a Botox treatment. Crumpuzas and colleagues identified common side effects such as ptosis, asymmetry, and redness. Satriasa described the pharmacological mechanisms of Botox and concluded that the treatment is generally safe with minimal adverse side effects. June and colleagues suggested that intradermal injections may reduce the risk of complications compared to intramuscular injections. Kaufman, Janet, and colleagues found that dosage of 20 units was optimal, while higher doses did not necessarily improve any effectiveness. Finally, Ratina and colleagues reported physical changes such as unnatural smiles and limited facial expressions due to toxin diffusion into surrounding muscles. To understand these findings, it is important to understand how Botox actually works. After injection, Botox binds to the protein known as SNAP25 at the nerve ending. This prevents the release of acetylcholine and temporarily blocks communication between nerve and muscles. As a result, muscle contraction is reduced, which smooths wrinkles and facial lines. One reason why systemic side effects are uncommon is because Botox acts locally only at the injection site. The doses used are also relatively low, and the toxin does not normally spread throughout the body. Therefore, immune and systemic reactions are rarely observed. The literature consistently showed several advantages of Botox treatments. These include effective wrinkle reduction, rapid recovery, individualized treatment plans, and a generally low risk of serious medical complications. Most adverse effects reported were mild and temporary. Examples include headaches, mild drooping of the eyelid known as ptosis, eyebrow heaviness, and slight redness at the injection site. Overall, the evidence suggests that Botox is a medically safe cosmetic procedure. Physical effects: despite the low medical risk, repeated Botox injection can produce noticeable physical changes over time. The most frequently reported long-term effects include facial asymmetry, unnatural facial expressions, muscle stiffness, and muscle atrophy. These effects occurs because Botox may diffuse into nearby muscles beyond the intended treatment area. When muscles remain inactive for long periods, they can gradually weaken and shrink, resulting in a sunken or hollow appearance. Additionally, different facial muscles recover at different rates, which can contribute to the asymmetrical facial movements and expression. Therefore, although serious health complications are uncommon, aesthetics consequences may develop with repeated treatments. So, based on the evidence reviewed, Botox appears to be medically safe for most patients. Serious complications involving the immune system or skin structure are rarely reported. Most concerns related to physical appearance rather than overall health. The study suggests that while Botox effectively improves wrinkles and facial lines, repeated treatments can alter natural facial movements and appearance over time. Therefore, patients should be aware not only for the benefits, but also the potential aesthetic consequences associated with long-term use of Botox. This review also identified several limitations in the current literature. Many studies focus primarily on glabral lines, which are the wrinkles in between the eyebrows. As a result, findings may not quite represent Botox applications in other facial regions. Additionally, many studies have relatively short observation periods and small sample sizes. As a suggestion, future research should include larger population, longer follow-up periods, and more diverse injection sites to provide a better understanding of long-term outcomes. So, in conclusion, botulinum toxin type A, or Botox, is generally considered safe and effective cosmetic treatment. The literature reviewed showed minimal systemic health risk and very few serious medical complications. However, with repeated injections, it may lead to long-term aesthetic changes, including facial asymmetry, reduced facial expressiveness, and muscle atrophy. Therefore, the key takeaway from this review is that while Botox is medically safe, frequent and prolonged use may produce undesirable physical changes that patients should also consider before undergoing repeated treatments. That is my presentation of my review paper today. Thank you for your attention, and I also apologize on behalf of any wrong sayings throughout the presentation. Thank you so much for listening. Additionally, this is the reference page filled with literatures used in this review paper. All articles and journals were listed in this reference list. I would also like to declare the usage of AI throughout this presentation project. I used AI exclusively to help in assisting stronger scientific vocabulary, grammar checking, and help structuring better and coherent sentences. That is all. Thank you so much for listening once again.